Hello, I'm Sue, one of the nurses here at Bega Medical Practice. You're here today for your AstraZeneca COVID-19 vaccine. Before we start, there are just a few health questions we need to ask you before you have your vaccine. Please let us know if you're feeling unwell today, if you have any allergies or have ever had an anaphylactic reaction. Let us know if you take a medication called methotrexate. Let us know if you have ever had a condition called heparin-induced thrombocytopenia, or if you've ever had a clot on your brain or anywhere else on your body. Please note you cannot have any other vaccination within 14 days before or after the COVID vaccination. This includes the flu vaccine. If you feel there is something about your health we should know about, please make sure you tell us when you come into the vaccination room. The vaccination that you're receiving today will not stop you from catching COVID, but it should stop you from becoming very sick and being admitted to hospital. You'll get better and longer lasting protection after your second dose, so it's really important to book in for your second vaccination in 12 weeks' time. Now I'm going to talk to you about some of the common side effects. Up to 25% of people may feel quite unwell after their vaccination and maybe even spend a day or two in bed. Some people show no side effects at all. Most people sit somewhere in between. Side effects aren't a bad thing. It's really just your body letting it know that you're mounting an immune response. Common side effects include pain, swelling, tenderness, redness, or itching at the injection site, tiredness, headache, muscle pain, chills, fevers, nausea, and joint pain. If this happens to you, just go to bed with Panadols and fluids and ride it out. You should be feeling much better within 24 to 48 hours. Less commonly, you may have enlarged lymph nodes, pain in your limb, dizziness, decreased appetite, or stomach pain. None of this is abnormal, but if you're concerned, don't hesitate to contact us. Now Duncan is going to talk about some of the rare side effects.
You'll have heard about the rare blood clotting disorder associated with this vaccine. This affects approximately 1 in 100,000 people who have the vaccine, and with treatment, only 1 in a million die. On the other hand, we know that for every million people who catch COVID, 35,000 will die. Forewarned is forearmed, so I'm going to tell you what to look for should you have a clot. Symptoms would start to appear 4 to 28 days after having the vaccine, not immediately. A brain clot would present as severe headache that doesn't respond to Panadol or Nurofen and feels different to your usual headaches. You may get blurred vision, slurred speech, weakness of your face or limbs, confusion, or even experience a fit. If you had a clot in your lungs, you would experience chest pain and breathlessness. A clot in your abdomen will present with pain, and if it was in your leg, you'd have swelling and pain. The flip side to this is bleeding, so you need to look out for a pinprick-like rash or unexplained bruising. Sometimes you can just get worsening weakness, which is very obvious. If you have any of these symptoms, you need to go straight to the hospital and tell them that you had the AZ vaccine and when you had it. This will help to speed the diagnosis and treatment.
After your vaccination today, we'll ask you to go back to the waiting room and sit for about 15 minutes before leaving. If you feel unwell, please make sure that you let someone know. At the end of your visit, we're going to upload your information to the Australian Immunisation Register. You'll also receive a text from something called SmartVax under the umbrella of Bega Medical Practice on day 3, day 8 and day 42 after your vaccination. This will help us to gather data on any significant effects you may experience. One of our team will be with you shortly. Don't forget to ask the doctor or nurse if you have any questions today.
Most importantly, good work for coming, and don't forget to tell your family and friends to do the same.